Charles Vincent. I'm Professor of Psychology at the University of Oxford, and my work is in research in patient safety. So this morning at the conference, Jean Brahmi, who is a primary care doctor, and I talked about safety in primary care. And we both tried to link the ideas of safety that have been developed mostly in hospitals to primary care. And we discussed how a framework for measuring and monitoring safety, which has been developed in hospital contexts, has some concepts that actually will work very well in primary care. Everyone has to think about harm, about the reliability of core processes, about the day-to-day safety in any setting in which you work, to anticipate, and somehow to bring all this information together, integrate it, and find time and space in the team to reflect on all the information on how we maintain safe practice and quality of care. But we also looked at some differences, and many of the ideas we have in safety come from aviation, from looking at incidents and accidents, and from places where safety can be managed by control, by automation, by very careful procedures and so on. Now, that's not really quite the case in primary care, which is a much more fluid and dynamic environment, more like trying to manage safety, with firefighters or people who go, work on very hazardous military environments, or for its risk cannot be completely controlled, but always just must be managed. And the other big thing is that the incidents in hospital happen over very short timescales on the whole, maybe a couple of days that build up to some problem. In primary care, you may have a problem developing over months. And we do not yet really have methods of analysis in safety, or concepts even, which will work quite so well in these primary care environments. So on the one hand, there are some big ideas that we can take and use very well in primary care, Jean and I felt, but we're going to have to adapt considerably to context, and primary care will have to develop its own particular approach to safety if it's really going to develop. And as a final point, I'd say, it is partly about the responsibilities of individual doctors and practitioners, but the bigger problems and the bigger risks for patients come from the way care is organised, and things like the coordination of care and the fact that 8 different people may be seeing patients and information is not being moved to them. These are probably the bigger risks to patients in primary cares than the particular mistakes or problems of individual practitioners.